Hi, my name is Stephanie Sutton, and I'm here to talk to you today about Alzheimer's education, research, and funding. In 1906, there was a German physician by the name of Alois Alzheimer's. He is a pioneer in linking symptoms of Alzheimer's. He was following a patient by the name of Augusta D. She had profound memory loss, had issues with doubting her friends and family as if they were trying to do something with her. And she also had profound worsening psychological changes. Upon her death, during her autopsy, he noticed that there was shrinking in the brain and that there was abnormal nerve endings, which profoundly pushed further the research to find out what this was, which eventually was discovered as Alzheimer's. Alzheimer's is a disease that affects the brain. It's a progressive disease. Sometimes Alzheimer's can be very slow progressing and it can be very fast progressing. It depends on when it's actually diagnosed into a patient. Some patients will have issues with behavior, issues with memory. They will have issues with sleep, eating. It pretty much affects the entire body, mainly the brain, but it ultimately affects every system in the body. The brain itself actually goes through a shrinking type. I'll show you pictures. I have pictures here I can show you. But the brain actually shrinks and nerve endings will actually swell. The openings in the brain will actually swell and allow fluid in, which causes the memory loss and the behavioral changes. There's also inflammation of the brain that can cause and affect missed thoughts and erratic behavior. Symptoms of Alzheimer's are usually you see the unfounded, the patient you will see becomes very suspicious of their family and friends, the ones closest to them. They will have a serious memory loss. Behavior changes can be from being a very, very sweet person to a very angry person. They will lash out at people. They will want to hit people because they don't really understand what everything is going on. Speaking will become difficult. Walking becomes difficult. Eating, swallowing becomes difficult for patients. Patients who have Alzheimer's eventually will die from this disease. There is no cure for this disease, so it ultimately is fatal once a person is diagnosed with it. There are many risk factors in this disease. Age is one of them. After the age of 65, the risk of Alzheimer's doubles every 5 years, and if you are 85 and older, the risk reaches nearly 50%. Which means if you are 85 years old or older, you have a 50% chance of getting this disease. Family history, it's usually a direct bloodline relative, which would mean mother, father, brother, sister. Also, genetics have also played an important role in scientists discovering that there are certain chromosomes in the human body that if it's missing a link in the chromosome, that you are more likely to develop Alzheimer's. I have some pictures here of what the brain actually looks like when you have Alzheimer's. This is a picture of what the brain would normally look like. Full, nice brain. This is a brain that has Alzheimer's. And this is a brain, the two of them compared. You can actually see the shadow of the normal brain, and then that's the brain that is affected by Alzheimer's disease. This is another picture of the Alzheimer's. This is the normal side of the brain. This is the healthy brain. This is advanced Alzheimer's. And you will see that like the cortex of the brain actually shrivels. And then the openings, these fluid sacs, will become larger. They allow more fluid into the brain, which allows the confusion, all the mood changes, and all the symptoms that you experience with that. Progression through the brain. Early Alzheimer's, it changes right here. You can start to see the fogginess in the brain. This is about 20 years prior to a diagnosis. This is mild to moderate right here. You can start to see that the fogginess is starting to become more throughout the brain. This is generally 2 to 10 years after a first diagnosis. This is severe Alzheimer's. This patient may last 1 to 5 years after being diagnosed. Okay. There are only 5 FDA-approved medications right now that help fight against Alzheimer's. Some of these medicines actually help slow the progression of the disease, but the slowness only lasts for some patients 6 to 12 months. So it doesn't last very long. It doesn't help very long. Treatments for these there are several different treatments that are out there right now that they are experimenting with. There are treatment trials, which these are trials that help test new drugs to see if they're effective or not. There are diagnostic studies, and these studies show doctors better ways and different ways to diagnose the disease. There's prevention trials. This helps doctors and scientists study and find ways to prevent the disease, like if it's something that we're eating or if it's something that we're ingesting. If it's something in our genes, maybe there's something they could give us to make those genes not develop into the Alzheimer's disease. There's also a new pacemaker research. This is actually where a pacemaker is implanted just like for a heart, but the wires are wired to the brain, and it actually zaps the brain every time that these people have a memory loss or an issue with the Alzheimer's disease. I have a video I'm going to show you about that. This came from a lady that actually had this implant put in. This is actually proven to help people with early onset of Alzheimer's, only early onset, and there's not really a big definition of increasing help. It just shows that her memory is increasing a little bit at a time. This is definitely not a cure for the disease, but it's definitely a sign of progression.
Imagine zapping your brain with mild jolts of electricity, all to ward off Alzheimer's disease. It might sound like a creepy science fiction plot, but it's actually a reality. Fox News explains.
Doctors at Johns Hopkins University are the first to perform the surgery. They have performed one surgery so far. The goal is to stimulate the brain, much like pacemakers do for the heart.
CBS This Morning spoke with an Alzheimer's specialist at Johns Hopkins University who explains how the brain voltage actually works.
Put 2 wires in the brain, in a part of the brain that we know is involved in memory. The wires are attached to, it looks like a pacemaker. It's a little battery that fits under your shoulder blade, and it puts electricity through these wires.
There was a pilot trial in Canada with 6 patients. The doctor reports they did somewhat better in terms of memory and did great in terms of brain metabolism. But WTVR's report indicates the technology may still need some improvement.
At this point, this procedure has only appeared to slow the progression of Alzheimer's disease in people who are in the very earliest stages of illness. The same procedure is commonly used to battle Parkinson's disease.
And the procedure isn't cheap. It can cost your insurance anywhere from $50,000 to $100,000. For Newsy, I'm Megan Murphy. Multiple sources, The Real Story.
There are also several different types of research that is being done besides the pacemaker treatments. There are research being done on mice with certain drugs. These mice have a reaction to the drugs, and it helps scientists know whether or not it's going to help with the disease. One of those is actually called bumethanol, and it's a medication that helps with keeping ammonia levels down in the blood, and this actually has been proven to help people with Alzheimer's, so hopefully it helps decrease the development of it. There are several different scientists now that are using different types of grants and funding to research cures for Alzheimer's. One doctor's name is Stephen E. Arnold, and he's actually using an insulin medication called metformin to see if it can actually decrease the disease, if it can help it stop it or even slow it down. There is a doctor by the name of Kurt Burden who is using an inhibiting forming type of medication to see if he can help the disease and discover the pathology of why this disease is around. There's also, in the Tampa area, there's a hospital, Alzheimer's research hospital, that they have discovered coconut oil is like brain for the food. Food for the brain. And it helps strengthen the brain, and it helps restore memory. Let's see. As we all should know, Alzheimer's is now the 7th leading cause of death in the United States. By the year 2040, the U.S. will be spending $40 trillion in research on Alzheimer's and taking care of people that have Alzheimer's disease. As far as insurance goes, I have my own personal experience with Alzheimer's. My grandfather suffers from it. He was diagnosed with it probably about 5 years ago. He has decreasingly gotten a lot worse. About a month ago, our family made the tough decision to put him in a nursing home. And it is a very sad and very debilitating disease. But there are several ways that we can help with this. There are several foundations that we can donate to. We can donate our time. We can donate our money. There is one fundraiser that's coming up in June. It's called the Longest Day Fundraiser. This helps bring awareness and research for Alzheimer's. And what you do is you just gather a group and you pretty much do activities all day from sun up to sundown, and you get people to donate to you and to your group. And you can donate these to nonprofit organizations such as the Alzheimer's Education. They do a lot of nonprofit fundraising. They're a nonprofit group. They depend on people like us to donate to them to fund researching for them. The FDA also partners with Alzheimer's Association to make sure that the funding is there for this research. Also, the government actually helps spend money to do research. They give about $50 million a year to help research for Alzheimer's disease. And in conclusion, just as American citizens, with this being such an enormous disease that's growing so fastly, we should all have a great concern in this disease. You may not know someone that's been affected by this, but regardless if you do or don't, eventually you will come across somebody that has. And the age group that it's starting to affect is getting younger and younger. Now they are seeing people in their 40s and 50s developing Alzheimer's. And when you think about that, some of us are in our 30s. I'm in my 30s. 10 years from now I can have it, which scares me to death to think that I won't know who my children are, or who my husband is, or who my family is. So I'm asking you to please just think about donating to local agencies that have research for Alzheimer's, or just logging on to Alzheimer's Association, or participating in the Longest Day Ever research fundraiser.